Good morning, everybody. Thank you for joining in our first ever virtual Precision Health Symposium. We really appreciate your flexibility and your enthusiasm for joining us. We know that part of the importance of the work that we do here within Precision Health at University of Michigan is to really bring people together. And we really enjoyed seeing everybody in person last year, back in May. It was just last year, it seems. And so unfortunately, we can't do that in person for very good reasons. We hope that you're all safe and sound, but we will still bring our community together, our community of participants and our community of researchers and faculty and students through the forum today. I want to give a little bit of background about Precision Health before we begin. First of all, I want to thank my co-directors and all the staff that have been part of Precision Health. So Jenna Weens from the College of Engineering, Mike Finke from the School of Public Health, and Rachel Dawson, the Managing Director of Precision Health, who helped make Precision Health happen. And then the staff who are really making today and many of the achievements that you see throughout Precision Health occur as well. Tina Krazier, Lori Robertson, Clarissa Piatek have done just person's work in making the symposium today happen. So I want to thank them as well for their hard work. And please be patient with us. We've done our practice sessions. We're trying to make sure the Zoom webinar works well for everybody. I'm sure there will be some challenges. We appreciate your patience with us. And please use the various chat and hand raising forums if there's particular problems that we can help with. So as you know, at the University of Michigan, we really feel as a public organization, our tripartite mission really pushes us to make sure that one of those missions, which is research and creating new knowledge, turns into actual impact that touches the lives of our communities, of the citizens of the state of Michigan, the residents of the state of Michigan, and our staff, faculty, and residents on a daily basis. We remain the #1 public university when it comes to research funding, and have really been driving a lot of the progress that we see in areas beyond just health. And what we've been trying to do within Precision Health is bring those other disciplines that really have been excellent for a long time and bring them together with the health research to make sure that we make progress as a group. A little bit of history of how we got here. This all started about 2012 was actually when the seeds of Precision Health at the University of Michigan began. Many researchers even before then were doing what we would call precision medicine and precision health. But some of the faculty that you will see that are presenting today first began helping collect data in 2012 with what we call the Michigan Genomics Initiative. Many of you on the phone right now are actually participants in the Michigan Genomics Initiative. We now have 80,000 participants in this effort, which was trying to bring together electronic health records, patient experience, patient surveys, participant experience, and then their genomic data. It first got started in 2012, and we continue to grow today. In 2017, President Schlissel announced the concept of precision health as a presidential initiative at the University of Michigan in October, actually. And then in 2018, in January, we really began our activities by bringing together the staff and faculty. And the focus of Precision Health is to really bring together discovery, prevention, treatment, and health across all 19 schools and colleges to bring those complementary components for a comprehensive initiative. We know that genetics is part of the answer, lifestyle is part of the answer, environmental factors, social determinants of health. No one focus is enough to really advance health, treatment, prevention. So we really have to bring all of them together and be humble about the areas that each of us is most comfortable with, and humble about the areas that each of us is most knowledgeable about, and realize that our colleagues and other disciplines are the key to actually making progress together. As you may have seen from previous slides or from previous presentations in this area, we really have 5 foci within Precision Health, 5 work streams: community development, which is about creating a cohort of participants, getting that data out using data analytics and IP, building the platforms for that analysis, making a difference at the point of care and via public policy and health implementation, and our education training work stream, which actually is designed to advance education, not just for our students and faculty, but also users of the Precision Health platform. On top of that, we have our research use cases as well. have we made progress? And that's one of the key things we want to dig into here is where have we made progress and where do we still need to make more progress? When it comes to community development, just over the last year, we've launched the Precision Health Participant Community. It's an evolution of the Michigan Genomics Initiative. And now any Michigan medicine participant can reach out to the University of Michigan, whether or not they're in one of our clinics or operating rooms, and actually do a virtual enrollment. As a result of COVID, we've had to learn how to do virtual enrollments using video, using phone, using apps on Android and iPhone. And we can send you a spit kit, or the next time you're in the health system for a blood draw, we can draw that blood type sample. And this is all done completely virtually. And we've had more than 100 participants go through this virtual process. We've reached out and learned from the community through participant studios to really teach us what the priorities of the initiative should be and how we should be progressing. And we started returning results back to participants at scale, not only ancestry data, but also data regarding their own activity, their own heart rate, their own blood pressures from wearables as well. In the data and analytics IT workstream, we've really ensured that each researcher doesn't have to think about the social determinants of health from scratch. We've taken the experts in that area at University of Michigan and infused their expertise and that data into all data that we are able to send out to researchers so that everybody is able to consider social determinants of health when they think about relating prevention, health, and treatment. And one of the major initiatives was to really bring the entire university together, all U of M faculty with appropriate approvals, IRB approvals, and appropriate training now have secure access to Michigan medicine data where we de-identify that data, make it indistinguishable from a identifier perspective, and actually bring researchers into a secure enclave to interact with that data to make progress in health science. We've improved our high performance computing environment so that people can do that research more efficiently and use the latest hardware to do that. On the implementation side, now we're actually taking genetic data and integrating into electronic health record in structured ways, not just in unstructured ways, so that we can actually start building logic on that genetic data. And we've brought together our researchers in machine learning and novel algorithms and actually interacting with real world data in real world settings to see how participants as faculty and clinicians interact with that data. On the education and training side, we've got our first Precision Health graduate certificate class enrolled. They're in the midst of their process now. They're a year into it. The workstream has also built out really helpful tutorials to help researchers use this platform. And events like today and throughout the year Symposium to bring together the researcher and participant community to make progress. We've also distributed more than $7 million in grant funding. We've made great progress in the opioid use case, which is trying to prevent long-term opioid dependence. And we've kicked off the mental health use case called Prompt, where we actually are enrolling patients remotely to see if remote interactions and using an iPhone or an Android app can actually help make progress in understanding a patient's daily symptoms and potentially help with it using different therapeutic options. We've learned a lot of things over this time period as well. The first thing we learned is that the community is our primary stakeholder. You've taught us a lot, both the participant community and the researcher community. We have to continue listening to you. We've earned your trust through the progress that we've made, but we need to keep that trust by continuing to engage with you and changing and evolving in that area. We've made a lot of progress when it comes to diversity in our cohorts. We used to be, as Michigan Medicine is, a relatively non-diverse community there, unfortunately. We've made progress through focused community engagement, reaching out to the community, having those conversations, but we need to continue making progress, and we'll have to make some tough decisions and continue having some tough conversations of how we do this the right way. We've definitely learned that connecting our researchers and clinicians, and not just researchers at Michigan Medicine, but throughout the entire university, bringing together all of those researchers and putting those committees together, bringing those perspectives together benefits not just our current patients, but future patients around the world as well. And as COVID and the many other issues going on really have shown us that, you know, we're learning about ourselves and to bring out the true character of our organizations. We have to be patient with ourselves. We have to be patient with each other and realize that we have to be safe. We have to feel safe in order to make progress on these important initiatives. And it's been a really insightful period for all of us, and we hope that you are safe as well. With that, I'll stop and hand off to Vicki Ellingrod, a professor in the College of Pharmacy, who will be helping lead us through the day's agenda today.